I will talk about complete cholesterol test, which is also called a lipid panel or lipid profile test. Your doctor can use it to measure the amount of good and bad cholesterol and triglycerides, which is a type of fat in your blood. Cholesterol is a soft, waxy fat that your body needs to function properly. However, too much cholesterol can lead to heart disease, stroke, atherosclerosis, which is a clogging or hardening of your arteries. If you are a man, you should get your cholesterol levels checked regularly starting by age 35 or younger. If you are a woman, you should begin routine cholesterol screening by age 45 or younger. To be on the safe side, you may want to get your cholesterol tested every 5 years, beginning as early as age 20. If you have been diagnosed with diabetes, heart disease, stroke, or high blood pressure, or if you are taking medication to control your cholesterol levels, you should check your cholesterol every year. Now I'll tell you who is at high risk of high cholesterol. Cholesterol testing is very important if you have a family history of high cholesterol or heart disease, or if you are overweight or obese, or drink alcohol frequently, smoke cigarettes, lead an inactive lifestyle, have diabetes, kidney disease, polycystic ovary syndrome, or an underactive thyroid gland. Well, all of these things can increase your risk of developing high cholesterol. And now I'll tell you what does a cholesterol test measure. A complete cholesterol test measures 4 types of lipids or fats in your blood. First, it will measure total cholesterol. This is the total amount of cholesterol in your blood. And then it will measure low density lipoprotein, that is LDL cholesterol. And this is referred to as bad cholesterol. Too much of it raises your risk of heart attack, stroke, and atherosclerosis. And the third type is high density lipoprotein, that is HDL cholesterol. This is referred to as good cholesterol because it helps remove LDL cholesterol from your blood. The fourth type of fat in this test is triglycerides. When you eat, your body converts the calories it doesn't need into triglycerides, which are stored in your fat cells. People who are overweight, diabetic, eat too many sweets, or drink too much alcohol can have high triglyceride levels. Okay. This test is very simple, and you just need 9 to 12 hours of fasting. Suppose if you want to take a test at 9 a.m. and then you should stop taking foods at 9 p.m. the previous day. Okay. So it should be ideally 9 to 12 hours of fasting, and you can drink water in this fasting period, and then you can go to the lab for your lipid profile testing. Okay. And now I'll tell you what are the results. What are the normal levels of this lipid profile test. Cholesterol levels are measured in milligram of cholesterol per deciliter of blood. Ideal results for most adults are LDL should be 70 to 130 milligram per deciliter. The lower the number, the better. HDL more than 40 to 60 milligram per deciliter. And HDL is a good cholesterol, so higher the number it is, the better. Okay. Total cholesterol should be less than 200 milligram per deciliter. The lower the number, the better. Okay. And triglyceride should be between 10 to 150 milligram per deciliter, and the lower the number, the better. So only in these 4 types of lipids, HDL should be high, that is better. Okay. All others should be low. So if your cholesterol numbers are outside of the normal range, you may be at higher risk of heart disease, stroke, and atherosclerosis. If your test results are abnormal, your doctor may order a blood glucose test to check for diabetes. Your doctor might also order a thyroid function test to determine if your thyroid is underactive. Okay. Then if the doctor finds that you have high lipid level, then the next steps will be of the treatment and the management of your high cholesterol levels. High cholesterol can be treated with lifestyle changes and medication. Lowering high levels of LDL in your blood can help you avoid problems with your heart and blood vessels. To help you lower your cholesterol levels, you should quit smoking tobacco and limit your alcohol consumption. You should avoid high fat and high sodium foods while maintaining a well-balanced diet. Eat a wide variety of vegetables, fruits, whole grain products, low-fat dairy products, and lean sources of protein such as fish and chicken. Okay. You should exercise regularly. Try to do 150 minutes of moderate intensity aerobic activity per week, as well as 2 sessions of muscle strengthening activities. Okay. Also, your doctor may put you on a therapeutic lifestyle changes, that is TRC diet. Under this meal plan, only 7% of your daily calories should come from saturated fats. It also requires you to get less than 200 milligrams of cholesterol from your food each day. Okay. Some foods help your digestive tract absorb less cholesterol. For example, your doctor may encourage you to eat more oats, barley, and other whole grains. Fruits such as apples, pears, bananas, and oranges. Vegetables such as eggplant and okra. Beans and legumes such as kidney beans, chickpeas, and lentils. Obesity is also a common risk factor for high cholesterol and heart disease. Your doctor may encourage you to lose weight by cutting calories from your diet and exercising more. Taking medications such as statins can also help keep your cholesterol in check. And these medications help lower your LDL levels. Overall, high cholesterol level is very manageable. Ask your doctor to help you create a treatment plan that you can maintain. It may include changes to your diet, exercise routine, and other daily habits. It may also include cholesterol lowering medication. The more proactive you are in making lifestyle changes and taking prescribed medication, the better results you will have. Okay. Well, this was my video about lipid profile test. There's a condition known as hyperlipidemia, or you can also call dyslipidemia. Some people also call it hypercholesterolemia, and this could be due to inherited reasons. Okay, I will make a separate video for hyperlipidemia on this channel, and you can watch that video. And in that video, I will I will tell you all the details about the treatment options for dyslipidemia. Okay, so keep in touch with this channel, and if you haven't subscribed till now, you can subscribe this. Okay, thanks for watching this video. See you in next video. Bye for now.